Trending in health headlines, preventing dementia. Researchers in California identified 9 lifestyle factors that could help prevent a third of all dementia cases. Dr. Raphi joins us now to explain. Good morning.
Good morning.
And this really is a topic that affects so many families. Like I was just asking you all these questions. You know, my family, my grandmother had Alzheimer's and dementia, and sometimes people even have an issue kind of separating the two. What is the difference between Alzheimer's and dementia before we get into the lifestyle changes?
Dementia is a description of a cognitive impairment. So the definition of dementia by definition means you have an impairment relative to the way that you used to be, relative to your intelligence. You have an impairment in your memory and at least one other cognitive function or thinking skill. So that means you can be impaired in your memory and your ability to sustain focus on things, your memory and your ability to see things in space properly, your memory and your ability to juggle information in your mind. So if you have that impairment, then you have dementia. And then there are many causes. I could talk to you all day about causes of dementia. Most scientists will tell you that the 2 most common causes of dementia are Alzheimer's disease and vascular dementia. Alzheimer's disease is a specific kind of a pathology, an abnormality that starts to increase in the brains of people as they get older, which ultimately results as a lack of, as an excess of free radicals in the body, which is a whole other story for another day. And vascular dementia is at least one or several strokes, which leads to dementia ultimately, but there's countless causes of dementia. Frontotemporal dementia, dementia due to head trauma, HIV dementia, so it goes on and on.
And now they're telling us that 9 different lifestyle factors that could prevent a third of these cases. What are those lifestyle changes that you can start implementing now to possibly prevent this down the road?
What I want to stress from that study is by far the most important ones are the vascular risk factors. Anything that puts you at risk for some kind of vascular disease. So that means any kind of heart disease like atrial fibrillation, some kind of a mitral regurgitation, high blood pressure, high cholesterol, diabetes, smoking, obesity, peripheral vascular disease, any one of those vascular risk factors puts you at risk for both vascular dementia and Alzheimer's disease. So,
and we're showing some of the issues that you should possibly manage here: depression, diabetes, smoking, loneliness. Those are all the factors that you were just saying that can add to this. Now, how early could you possibly start seeing any of the signs? And is it too late to start any of these processes to help avoid it?
Yeah, absolutely.
Not speaking for myself at all.
So there is a large family in South America that has been the subject of a lot of research. A lot of their members of the family, they have a very strong genetic predisposition towards Alzheimer's disease, and a lot of their family members have developed Alzheimer's disease in their 30s. But the way to think of it is the biggest risk factor for Alzheimer's disease and other dementias is increasing age. We can't do anything about that. Right? The next biggest risk factor is, like I was saying, vascular risk factors. After that, in my book, it's depression. So
give us a couple things, so because we have to wrap up really quick. Basically, we need to be eating right, moving the brain, thinking, reading right, and some exercise are probably kind of the top 3, the common medicines for getting better.
Absolutely, yeah. And having a high level of intelligence is important. You want to educate yourself, have as much education as possible, but in my book, the 2 most important things you can do: talk to your doctor about your vascular risk factors, and don't become socially isolated and depressed as you get older. If you're feeling depressed, talk to your doctor about it.
All right, thank you so much, Dr. Wald. All right, we'll have more tips from Dr. Wald on our website, cbs12.com. We'll be right back.